Welcome to week 4, the final week of our Natural Calming Protocols month. You have done a lot this month. Stress and anxiety assessment, nutritional foundations, supplement layering, herbal protocols, home environment audit, pheromone therapy, T-touch and fear-free handling principles. That's 5 complete layers of a holistic calming protocol. This week, we take everything we've built and apply it to 3 specific scenarios. The ones that are hardest to navigate and practice: separation anxiety, noise phobia, and situational anxiety around vet visits, grooming, and travel. We also have our capstone Q&A coming up on the 28th at 7 p.m. Bring your questions there, and let's get into the last week. Before we go into specific protocols, I want to establish one principle that underlies all 3 situations we're covering this week. Every anxiety or handling experience your pet has leaves a trace in the nervous system. A positive experience, calm, treat-rich, below the anxiety threshold, makes the next one slightly easier. A negative experience makes the next one slightly harder. By the time your pet is 5 or 6 years old, they have accumulated dozens of these traces. Their response in the vet's waiting room today is not just a response to today. It is the sum of every previous experience layered together. Proactive management prevents that from compounding. Reactive management compounds the damage. This is the entire logic of what we're doing this week. So, separation anxiety. The most common anxiety presentation I see, and the one most likely to be mishandled, because the instinctive responses are exactly wrong. Punishing the destructive behavior does not work, because the behavior is panic, not choice. Getting a second dog for company does not work. The separation anxious and the animal is attached to you specifically. Flooding, leaving for longer to get them used to it, produces trauma, not habituation. What's actually happening when your dog anticipates your departure, the sympathetic nervous system fires as though there is a genuine threat. Cortisol spikes. Adrenaline floods the system. The prefrontal cortex, the thinking brain, goes offline. What you see as destruction or vocalization is the nervous system doing what nervous systems do in panic. The HPA axis in a separation anxious dog is not functioning normally. The stress response activates too easily, escalates too rapidly, and recovers too slowly. Every layer of the protocol targets that dysregulation. Before you change anything about your departure routine, build a nutritional and supplement foundation. Daily, tryptophan-rich protein in the morning meal on days you're leaving. Turkey, eggs, or chicken with a small amount of sweet potato or pumpkin. The carbohydrate improves tryptophan's access to the brain where it converts to serotonin. Daily omega-3s, daily fermented food, daily magnesium via pumpkin seeds. These shift the neurochemical baseline over 2 to 4 weeks. Adaptogens. Start 4 to 6 weeks before any planned increase in alone time. Herbsmith Calm Shun, Standard Process Calming Comfort Pro, or ashwagandha. These require consistent daily use over weeks. They are not PRN supplements. They lower baseline cortisol over time. Start now before the situation worsens. Pre-departure, 30 to 60 minutes before leaving. L-theanine, Spirited Paw Calm, or Composure Pro. CBD if you're using it 45 minutes out. If your dog has a Pet Loop Pro, run the Harmony program that morning. These stack on top of each other. The adaptogens create the foundation. The pre-departure tools add the immediate layer. Environment. Sentry or adaptable diffuser running continuously in the space where your dog is alone. Not just during departures, continuously. White noise running while alone, and the highest leverage environmental tool for separation anxiety. High-value enrichment, frozen Kong, lick mat, given only during alone time, never at any other time. Over weeks, being alone begins to predict something wonderful. This is not a cure, but it meaningfully shifts the emotional valence of your departures. Behavior. Start with departure cue desensitization. The dog's anxiety often begins before you leave. It's triggered by keys, shoes, bag, coat, because those cues have been paired with the terror of separation hundreds of times. Break the pairing. Pick up your keys, sit back down. Put on your shoes, make tea. Dozens of times daily for 2 to 4 weeks until the cues lose their predictive power. Then graduated departures, starting in seconds, not minutes. Step outside, count to 10, return. The dog must reach calm baseline before the next departure. And the critical rule, never return when the dog is vocalizing. Wait for a moment of relative quiet. Returning to distress reinforces the very association you're trying to break. For moderate to severe cases, discuss fluoxetine or clomicalm with your vet alongside the behavioral work. Medication creates the neurological conditions for learning to happen. A dog in full panic cannot learn. It is a layer, not a surrender. Noise phobia. The entire strategy is proactive. The window for meaningful intervention opens well before the first thunder and closes rapidly once the storm is underway. Once a dog is in full activation, most interventions have limited effect. Check the weather forecast. Set your protocol before you hear the first rumble. 60 to 90 minutes out, melatonin for dogs, dosed by weight, always xylitol free. Always check the label. L-theanine at full dose. Herbsmith, July 3rd, their situational acute herbal formula designed specifically for trigger events like storms and fireworks. Those are available at the Big Bad Wolf. CBD if you're using it. For cats, Alzu calming wipes on the bedding and around the carrier 30 to 45 minutes before. 45 minutes out. Thundershirt on before the dog starts showing anxiety, so the wrap is associated with calm rather than crisis. Sentry spray on a bandana. Always allow 15 minutes to dry first. The alcohol carrier needs to evaporate. Move to the safe space. White noise machine on. Your energy matters here too. Be present and calm. Your nervous system directly influences theirs. Once the event is underway, these interventions still make a difference, particularly for dogs at moderate rather than severe activation. Tellington T-Touch. Ear slides are what I reach for first. Slow strokes from the base of the ear to the tip. Rhythmical and unhurried. I have personally seen dogs in significant thunderstorm distress de-escalate through consistent ear slides within a few minutes. The ear carries a dense concentration of nerve endings and acupressure points that respond quickly. Tail work alongside. Gentle handling and light traction from base to tip, supported throughout. This is the technique I've seen produce the most dramatic in-the-moment results, specifically for noise phobia. If you're going to learn one T-Touch technique for storm season, make it these two. Remember, I strongly recommend working with a certified T-Touch practitioner to learn these properly. ttouch.com. What I'm describing here is a starting point. If a dog will engage with food at their current activation level, a frozen lick mat activates the parasympathetic nervous system through the licking and chewing action. Most dogs at severe anxiety won't engage with food, but for moderate anxiety, it's worth having ready. And for dogs who react to lightning flashes as much as to thunder, pet goggles or a head screening wrap that block peripheral vision stimulation and help them cope with the light as well as the noise. Not every noise-phobic pet is experiencing the same underlying imbalance, and in TCVM, that means the herbal and dietary support can be much more precisely targeted when we identify the problem. Heart-blood deficiency is the most common pattern underlying noise phobia. The Shen, the spirit, has nowhere to anchor when heart blood is depleted. These pets startle easily, panic rapidly and recover slowly. They tend to be thinner with a dull coat. During noise events, they escalate fast and take a long time to return to baseline. Herbsmith Calm Shen directly addresses this. It nourishes heart and kidney to settle the Shen. Liver, eggs, and dark meat proteins are the food support. Heart yin deficiency shows up as anxiety with heat signs, panting without physical exertion, restlessness at night, seeking cool surfaces, and they're worse in summer heat. If your dog is significantly more anxious during July storm season than during winter storms, heart yin is worth considering. Cooling proteins, rabbit, duck, fish, support this pattern. Reduce warming foods like lamb and venison. And liver qi stagnation is the noise-phobic dog with an edge. Irritable, reactive, sometimes growling or snapping during the event. Significant body tension. There's frustration underneath the fear. Passion flower and skullcap both move liver qi and calm the shen appropriately for these dogs. Physical movement and enrichment before storm season keeps liver qi flowing and lowers the reactivity threshold. Earth Animal and Animal Essentials carry relevant formulations at the Big Bad Wolf. The TCVM layer doesn't replace the Western pre-event protocol. It adds constitutional precision. The protocol manages the acute event. The TCVM work addresses the sensitivity driving it. Between storm seasons, this is the work that actually lowers the phobic response rather than just managing it acutely. And it requires patience. Play storm or fireworks recordings at a volume so low your dog barely notices, well below their anxiety threshold. While the recording plays, give meals, engage in play, do calm positive activities. Over weeks, incrementally increase the volume, and never to the point of triggering anxiety. If you see early signals, turn it back down. This is a 3 to 6 month project. You're not going to desensitize a noise-phobic dog between July and August. You are building the foundation for next summer. iCompet and YouTube both have appropriate recordings. Do not flood. Forced exposure to the full intensity trigger does not produce habituation in anxious animals. It produces trauma and usually worsens the response. When to involve your vet? Cilio is FDA approved specifically for canine noise aversion. A dexmedetomidine oral mucosal gel given 30 to 60 minutes before the event. Fast acting, shorter duration than some older options. Significantly reduces anxiety without deep sedation. Ask your vet about it before the next storm season, not during it. Trazodone, gabapentin, and alprazolam are also used situationally for noise phobia. For cats, gabapentin pre-event is now standard of care at Progressive Feline. Ask your vet proactively. And I want to say this clearly. Using medication for noise phobia is a tool, not a failure. For acute or severe cases, it is often the layer that makes the behavioral and nutritional protocol possible. A dog in full panic cannot benefit from desensitization. A calmer dog can. For dogs at the vet, the single most impactful thing you can do between appointments is schedule happy visits. Brief drop-ins with no procedure. Walk in, get weighed, get treats from the tech, walk out. Many fear-free practices build these in proactively. Ask directly. Day of the visit, tryptophan-rich breakfast. Don't withhold food unless the procedure specifically requires fasting. L-theanine and Sentry spray on a bandana 60 to 90 minutes before departure. Always let the bandana dry 15 minutes first. If your vet has prescribed pre-visit gabapentin or trazodone, dose per their instructions, typically an hour and a half to 2 hours before. At the clinic, arrive early and wait in the car. Text when you arrive and ask to be taken directly to an exam room. The waiting room, with its dog smells, unpredictable sounds, and proximity to other stressed animals, is one of the highest anxiety elements of the entire visit. Eliminate it when possible. Bring the highest value treats you have and use them generously throughout. Speak calmly and normally. Anxious hovering, apologetic tones, excessive reassurance all communicate to the dog that there is indeed something to worry about. And if your dog begins showing early FAS signals in the exam room, lip licking, whale eye, stiffening, say so to the tech. They're showing some stress signals. Can we slow down and give them a moment? A fear-free certified team will respond well to this. One that doesn't is telling you something. For grooming, the same supplement protocol applies. Seek out a fear-free certified or low-stress groomer. Ask whether they allow happy visits between grooming appointments. For cats at the vet, the most impactful intervention is year-round carrier conditioning, not a day-of fix. The carrier lives out with familiar bedding and a worn item of your clothing inside. You feed near it. Your cat sleeps in it. By the time the appointment comes, it is a familiar resting space rather than a threatening one. A day of Fill Away Classic or Alzu wipes inside the carrier 15 minutes before loading. Allow the spray to dry. In the waiting room, cover the carrier with a towel and keep it elevated. Ground level is where cats feel most vulnerable. In the exam room, let the cat exit the carrier themselves if possible, or remove the top entirely. Many fear-free vets conduct a full examination in the bottom of the open carrier. Never pull a cat out through the carrier opening, and ask your vet proactively before you need it about pre-visit gabapentin for your cat. It is now standard of care at Progressive Feline Practices. It makes a real and visible difference. For car rides and travel, build a positive association through short practice rides with no stressful designation. Car-only high-value treats. Familiar bedding and a worn clothing item in the travel space. L-theanine and Century Spray, 45 minutes to 60 minutes before longer trips. If your pet is motion sick alongside anxious, address the nausea first with Serenia from your vet before attempting any behavioral work. You cannot build positive associations with something that makes you physically ill. For air travel, discuss the medication protocol with your vet well in advance of travel dates. Let me take a moment before we close to look at what you've built this month, because I want you to see the scope of it. 4 weeks ago, most of you started with an anxious pet and maybe one tool. This month, you've built 5 layers. Layer 1, you know what to feed. The nervous system has the building blocks it needs. Layer 2, you have a supplement protocol matched to your pet's specific anxiety type. Situational versus chronic, acute versus daily. Layer 3, you understand herbal medicine for pets. The TCVM patterns, what species safe, what works for which presentation. Layer 4, your pet's home environment communicates safety. Safe space, sound management, the right pheromone for your specific situation. Routine. Layer 5, behavior modification. T-touch body work, fear-free handling, and when to bring in veterinary partnership, working with the nervous system, not against it. Each of these layers lowers the anxiety burden a little. Together they create a nervous system that can actually rest. Not because the world became less stressful, because your pet's capacity to handle stress has genuinely increased. That is what this month was for. Your action steps from here. First, download the month-end reassessment worksheet from your Week 4 lesson page. Go back to your Week 1 assessment. Compare the scores. Even small shifts are meaningful. A slightly quicker recovery time, 1 fewer trigger event, a lower baseline score. Document them. They tell you the protocol is working and which layers are doing the most. Second, identify what continues into August. The 5-layer protocol is not a July project. The daily nutritional foundation, the adaptogenic support, the pheromone therapy, the fermented foods, these are ongoing. The environmental changes you made stay in place. They're now simply how you care for your anxious pet. Third, bring your questions to one of the Q&As. Our capstone Q&A for July is on the 28th at 7 o'clock Eastern. Bring your specific pet, your specific protocol, your hardest remaining questions. If anyone wants to see T-Touch on camera, let me know in the discussion thread. We will make it happen. Fourth, if you want a fully personalized protocol built specifically for your animal, one-on-one consultations are available through woofnutrition.com. And fifth, if you know someone with an anxious pet who hasn't had access to this information, share it. The July 7th YouTube video is public. Every anxious pet deserves a comprehensive approach. Thank you for this month, and I will see you at the Q&A.